Buenos días, sean ustedes bienvenidos al 18º Foro Nacional y Cuarto Internacional de Educación en Salud del Instituto Mexicano del Seguro Social. Saludamos con el mismo grado a invitados especiales que se encuentran con nosotros en este día e igualmente damos la bienvenida de manera virtual a los participantes que se inscribieron en línea. A todos ellos que nos distinguen con su presencia de manera remota en todo el país, a través de nuestra página de la Coordinación de Educación en Salud, sean todos ustedes bienvenidos. Para dar inicio a las actividades del día de hoy, tenemos el agrado de presentar la conferencia Ethics and Governance of Artificial Intelligence for Health, Who Guidance, a cargo del Dr. Andreas Alois Reis.
Muchas gracias. Tenemos el gusto de presentar la semblanza de nuestro ponente, el doctor Andreas Alois Reis. Es el jefe adjunto de la Unidad de Ética y Gobernanza de la Salud en la OMS en Ginebra. Obtuvo un doctorado en Medicina de la Universidad de Heidelberg en Alemania, una maestría en Economía de la Salud en la Universidad de Colonia, también en Alemania, y un título de posgrado de Ética Médica de la Universidad de Erlangen-Nuremberg, Alemania. Es coordinador de la Red Global de Centros Colaboradores de la OMS para la Bioética. Su trabajo se enfoca en los aspectos éticos de las enfermedades infecciosas, la vigilancia de la salud pública, la investigación en salud y la inteligencia artificial en salud. Ha sido líder ético del proyecto de la OMS sobre ética y gobernanza de la inteligencia artificial para la salud. Ha publicado ampliamente y es coeditor de 4 libros sobre ética en la salud. Integra los comités editoriales de ética de la salud pública y Monash Bioethics Review. Ha impartido conferencias y organizado capacitaciones para la OMS en más de 50 países. Es por lo que es un honor tenerlo el día de hoy con nosotros. Muchas gracias. Welcome, Andreas. Welcome to Mexico, virtually. Thank you very much.
In Geneva. And I have the great pleasure of presenting to you WHO's work in the area of ethics and governance of AI for health. Now, why is the World Health Organization concerned with artificial intelligence for health? AI is a very rapidly growing sector that could become a $15 trillion industry by 2030, and it has potentially many healthcare applications. AI technologies have an enormous potential to not only strengthen healthcare, but also health research, drug development, and public health services such as public health surveillance. AI for health also raises some potential ethical challenges and could even undermine core human rights obligations. For WHO, the big question is, how can we use AI to achieve universal health coverage while we ensure that human rights and ethics are at the center of the design and deployment of AI for health? And here you see the rapid growth of medical AI studies by year during the last couple of years by medical specialties. And you see that there is literally an exponential growth, an explosion of studies, in particular in the fields of radiology and pathology. So we have many potential and emerging uses of AI in the field of health. There's a big application, as we've just seen on the last slide, in the area of radiological and pathological diagnosis, for example, in thoracic imaging, colonoscopy, mammography, brain imaging, and melanoma detection and screening, and so forth. There are applications, for example, in the area of RNA and DNA sequencing that can guide immunotherapy. There's an enormous area of usage and application in the research and development of medicines and vaccines. There are predictive systems to identify risks of birth asphyxia. AI has been employed and will certainly be employed more in the future for public health surveillance during pandemics. And there are many other potential uses that I will be mentioning during the course of this presentation. One particular area of application for AI has been the field of detection of melanoma. Several studies have actually shown that deep learning is capable to classify images of benign nevi and melanoma with the same level of precision as very experienced dermatologists. Unfortunately, here in this example, you can also see one of the difficulties with AI, because while this AI algorithm did very well on white skin, it turned out when afterwards it was used for black people that actually the results were really poor. And the reason was that the algorithm had only been trained on white skin. So there was this bias. And this illustrates already the point why it's so important to have a very comprehensive data set to train the algorithms. Another very famous example of where AI has really revolutionized practices is the prediction of protein structures, which has been really, it was a game changer to have this algorithm by AlphaFold, which has transformed our understanding of proteins. So we've seen there is enormous potential for the application of AI, but at the same time, there are also significant ethical challenges. The first one is the very basic question: when should AI even be used? And as you know, in many countries, the healthcare budget is quite limited. And so you might ask, if you don't even have enough budget to cover basic health services, why should you invest in expensive new technologies such as AI? And so the basic question about cost effectiveness is a really important one for many countries. The second point is the digital divide. So we know that already now in many societies, but also across countries, there are big differentials in terms of access to digital technologies and digital literacy. And there's a big ethical concern that AI might even exacerbate this divide and this inequitable access to healthcare. The third big concern is about the data collection and use. There are many issues, as you know, about data privacy and also the sharing of data across borders. That is an entire area of ethical concern, and especially also the use in different countries from data that have been collected in other countries is potentially a big issue. The fourth point is the accountability and responsibility for the use of AI. There is a big concern that humans might lose control over the technology, and this has also to do with the next point, the autonomous decision making. There needs to be safeguards in place to ensure that humans always will remain in control and take the last decision. The next point, bias and discrimination associated with AI. I already illustrated with one example on the melanoma screening. There is a big concern that the data sets to train the AI algorithms might not be comprehensive enough to ensure an unbiased result. And so it's very important that the algorithms get trained on varied data sets that also include data from vulnerable populations, for example, to ensure that there's no bias and discrimination. There are many risks of AI to safety and cybersecurity. We know that more and more hospitals have problems with this area of cybersecurity, and there's a concern that with AI and the more and more applications we have, there might be even more risks in this area. I myself was actually surprised to learn at the beginning of this project that there are potential implications for climate change because AI uses up so much energy. So that's an ethical concern that we really should keep in mind. There are huge concerns about the impacts of AI on labor and employment throughout the society and the economy, but also for the area of healthcare and medicine. And finally, one of the biggest challenges in this field is that it is actually dominated by very few very large companies, and there's a huge market and huge concern that these companies might not follow the rules and might not work in the common interest, but are driven by profits. So with this in mind, WHO about 3 years ago established an expert group to develop WHO guidance on ethics and governance of AI for health. And you see here on this slide the expert group of about 20 international experts from all WHO regions and from a variety of backgrounds, from IT and computer science to ethics, human rights, policy making, and philosophy. And so this is a typical setup for a WHO expert committee. That committee worked for almost 2 years to develop the WHO guidance document that was then published about 2 years ago. And it has sections on the opportunities and ethical challenges. Very importantly, it came up with the first set of consensus principles in this area. It has a lot of discussion about potential governance options, a set of recommendations, and then checklists for ministers or ministries of health, designers, and providers. And in the following slides, I will discuss some of the most important aspects of this work. When WHO starts to develop international guidance or guidelines, the first step is always a thorough review of the literature. And when we analyzed the literature on principles for AI, we actually found at the time we started this project already more than 70 sets of principles. But actually what we found is that the principles at the time, they only applied either to a national or regional context or to AI in general. And so the expert group, the WHO expert group, decided to develop their own principles on specifically AI for health that would be universally applicable at an international level. And here are the 6 principles that WHO agreed upon. So the first one is protecting autonomy. The second one, human well-being, human safety, and public interest. Ensuring transparency, explainability, and intelligibility. Foster responsibility and accountability. ensuring inclusiveness and equity, and promoting AI that is responsive and sustainable. And in the following, I'll go through a bit more detail with these principles. The first of the WHO consensus principles is protecting autonomy, which is of course one of the key ethical principles in healthcare. In this specific context of AI, it means that humans should always remain in control of healthcare systems and medical decisions, and informed consent should always be respected. The second one of the principles, promoting human well-being, human safety, and the public interest, means that first, we should prevent harm through AI, and there are a lot of regulatory requirements for the safety and quality control that should be put in place by every country. The third consensus principle is to ensure transparency, explainability, and intelligibility. This basically means that AI algorithms and technologies should always be intelligible or understandable to developers, medical professionals, patients, users, and regulators. And there shouldn't be the black box phenomenon where nobody actually knows what the technology does. The fourth consensus principle is fostering responsibility and accountability. And this is really to ensure that AI is always used under appropriate conditions and by adequately trained people. And some people have also called this the human warranty. The number 5 consensus principle is ensuring inclusiveness and equity. And as you know, equitable healthcare services, universal health coverage is one of the main goals of the World Health Organization. So in this field, it really means that we ensure the widest possible equitable access and use to AI technologies to minimize the bias and discrimination and disparities. And that's why we need to continuously monitor the impact on equity of rolling out digital technologies and AI. And the final principle is promoting AI that is responsive and sustainable. So this really sees AI in the wider context of the environment, for example. So AI technologies should be consistent with a wider promotion of the sustainability of health systems, environments, and workplaces. Another very important concern discussed in the WHO guidance document is the governance of AI for health. And this is a particularly tricky area. The document discusses the legal, regulatory, and non-legal measures for ethical use of AI for health. And it also identifies some potential areas of governance that could resolve some of the identified ethical challenges and ensure the application of the 6 consensus principles. There is a total of 47 recommendations for diverse stakeholders that they could implement. Of course, I don't have time to go into all of them, but here are just some selected recommendations. So the recommendations are targeted at particular stakeholders, for example, the designers that should ensure that AI systems are designed to perform well-defined tasks and to advance patient interests. Governments have to enact laws and regulations and policies, for example, to conduct impact assessments. They should also include civil society and NGOs to make sure that vulnerable populations, among other groups, are included in the development and use of these technologies. Civil society also has an important role to play in participating in the design and use of these technologies, hopefully as early as the conceptualization phase. And then finally, the large and small companies that are active in this field have a lot of responsibilities to adhere to national and international laws and regulations in the development and use and in the commercialization of AI for health systems and for healthcare. The WHO guidance document then has a section of checklists. This is because the experts felt that we shouldn't just stay at the normative, level, but should also give some more concrete guidance to selected stakeholders. So the guidance document now includes considerations with very practical steps to assist with the implementation for specific target audiences. One are the designers and programmers, the second are the ministries of health, and the third, the providers, namely the hospital systems and healthcare professionals. There are a lot of implications for healthcare providers for that last group, and I'm just giving you a few examples. So there's a concern about the impact on AI in the midterm about on the patient-provider relationship, and actually the Council of Europe has a very dedicated expert group on this particular topic. How will the relationship between patients on the one side and the providers change if we introduce more and more AI technologies? That's a big concern. I already mentioned the inequality in access to healthcare in general, but even more concern is about the access to high technology and potentially expensive healthcare. There is an ethical concern about the transparency and the explainability of these technologies, and there's a big need for specific training of healthcare providers in order to understand these technologies and also to be able to explain them to their patients. There is a risk of de-skilling. So if more and more healthcare services are taken up or taken over by AI algorithms, there's some concern that maybe healthcare professionals could lose the ability, for example, to interpret certain radiology images or other pathology screening and so forth. And finally, there are a lot of issues and concerns about responsibility and liability. Who is responsible, who's liable if something goes wrong in the application of an AI algorithm? So far, I've focused on the WHO guidance document, which was, as I said, published about 2 years ago. I would, in the remainder of the presentation, like to focus on the implementation and the impact in countries. So what have we done since the publication of the guidance document? One, we have developed an online training course. Second, we are at the moment developing a specific training course for developers. We have done a lot of workshops, and we have started to publish additional guidance and tools in specific areas. And I will talk about these issues a bit more in detail in the following slides. For one, we have turned the guidance document actually into an introductory course on ethics and governance of AI for health. This is available openly and for free at the WHO site that you see on the slide. More than 16,000 people have already enrolled during the last year, and we have had participants from more than 130 countries. The course takes about 3.5 hours. It consists of 7 modules and 3 practical guidance sections. That's the checklist that I had mentioned. There are pre- and post-course surveys, video presentations by some of the leading experts, and some reading materials and useful links. At the end, there's a knowledge check and a final course assessment, and you get a certificate. When we published this course, as I said, there was a very good feedback, but also some criticism. So at a meeting last year in Berlin, mainly consisted of designers and AI programmers, they said, well, this is a great course, but actually it's not practical enough. We want to know how we can include ethics from the start in the design, in the programming of AI algorithms. So could you please develop a specific training course for us designers and programmers on how to include ethics by design from the start? And so this is what we started about a year ago, developing an online curriculum specifically for programmers on integrating ethical considerations into the design of AI technologies from the start. The course is currently being finalized, and we hope we can publish it early 2024. The other big area of activity that we have been doing since the publication of the guidance is to hold regional workshops. So in November of last year, we held a large workshop in Panama for the countries in the Pan American region with more than 70 participants. In December last year, we held a regional workshop in Copenhagen, mostly for European participants and also from the Western Balkan countries. And then also in December, WHO organized a workshop, a 3-day workshop in Cairo, Egypt, with over 30 participants from various countries in the Eastern Mediterranean region. And then finally, about 2 months ago, WHO organized a workshop in Cape Town, South Africa, for the African region, and there were 56 participants from various African countries. I think these workshops have really contributed to the dissemination and implementation of the WHO guidance. That's always very important for us, that these guidance documents don't only stay on the shelf in Geneva, but that we really work with countries to implement them. And this also serves to get a lot of feedback on the utility, on the usefulness of the guidance, but also to get some ideas and get a better understanding of what other products, what other tools are needed in country. And so this is why we have started in the meantime the development of additional guidance on specific areas and of dedicated tools. So one of the topics that had been highlighted to us was the potential of ageism if using AI for health. So we have had a very fruitful collaboration with the Healthy Aging Unit at WHO and produced a policy brief on ageism and AI, which examines the use of AI in medicine and public health for older people. There is a potential where AI could exacerbate or introduce new forms of ageism, And this policy brief discusses legal, non-legal, and technical measures that can be employed to minimize the risk of ageism in AI and maximize the benefits of AI for older people. Here are some other areas where we have received feedback or requests to develop WHO policy briefs, which are shorter documents of about 10 to 20 pages that discuss key issues in AI for health. So one is the area of pharmaceutical R&D, where AI is set to really be a game changer in the future, and there are a number of ethical and governance issues that need to be considered, and we're currently finalizing such a policy brief, which should hopefully be published by the end of this year. We also received a request from countries that it's very good to have the ethical principles, but it would be necessary to give some more concrete guidance on how to translate the ethical principles into legal measures, into health legislation for digital health and AI in countries. So we're at the moment working on a policy brief for health legislation. The third area that we have started to work in is AI and evidence-informed policy development. So, as you know, AI has been used to evaluate, assess, and summarize evidence, which is, of course, a key pillar of policy development in health. And this is an area that we are also looking at and developing a WHO guidance document. Another area where AI has found many applications is reproductive health, for example, in cervical cancer screening, but there are also a lot of ethical issues associated, for example, with data of visual inspection and data sharing in this very sensitive area. So we're also collaborating with the Department of Reproductive Health of WHO, and work is forthcoming in that area. Another big area where AI is also employed is the area of infodemic management and social listening, and WHO has established a dedicated working group on the ethical issues that arise in this area, in particular during pandemics such as COVID-19. And WHO will produce a full guidance document in this area in 2024. Finally, you all know about the big hype and the rapidly growing area of generative AI, and so WHO has employed its expert group on ethics and governance of AI to provide advice, and we have been developing a policy brief on the ethical and governance issues of using large language models and generative AI, which is expected to be published in November of this year. So, where are we going in this area of AI for health? I think it is fair to say that there are enormous possibilities in the area of new technologies such as AI, digital health, genome editing, or neurotechnology. There's an enormous potential for improving human health and welfare and society. But we have to be mindful that there are also some potential serious risks. And what is very important is that there is a need for standards and regulations, both at the international, but also at the national level, to make sure that we keep ethics and human rights at the center of these developments. The famous physicist who unfortunately passed away a few years ago, Stephen Hawking, once said, "Our future is a race between the growing power of technology and the wisdom with which we use it." Before closing, I would like to acknowledge my colleagues Samir, Shada, and Yu from the WHO Department of Digital Health Innovation, with whom this project has been done in very close collaboration. And above all, also our consultant Rohit Malpani, who has been the lead drafter of many of the documents that I mentioned, in particular also the WHO guidance on ethics and governance of AI for health. And I also, last but not least, would like to thank our WHO expert group in this area. We all must ensure that the digital health revolution is safe, sustainable, and leaves no one behind. Thank you very much. Muchas gracias.
Thank you very much, Andreas. We have a few minutes so we can have some questions from the public. We're really grateful for the speech, so we're going to open to the public the questions. Si tienen algún comentario, alguna pregunta para nuestro ponente, adelante, lo pueden hacer también en español. ¿Algún comentario? Adelante, si hay atrás, le pasamos el micrófono, por favor. Muchas gracias.
Hi, Dr. Andreas, good morning, or maybe I should say good afternoon for you. I am a family medicine resident, and I have a question. Is artificial intelligence replacing human abilities? You talked about some risk of the skilling human abilities, so that is my question.
Right now, you want to collect a few questions.
Yeah, sorry. My question is about, is artificial intelligence replacing human abilities, or maybe in the future?
Yes, I understood your question. I will answer it very happily. Thank you very much. It's an excellent question, and this is a concern for many workers, not only in the health sector. I think it's also a big question for factory workers, for journalists, for screenwriters, and so forth, but also in the health sector. This is a very important question. And I think for the immediate, next few years, for sure, there's no danger that AI will be replacing humans. But I think in the midterm, what we are going to see is that there will be more and more use of AI-based tools in clinical medicine, especially in the area of diagnostics and screening. And there is a certain risk of de-skilling, meaning that professionals potentially, if they only rely on these algorithms, they could lose the ability to actually make the diagnostic by themselves. And so it will be very important to keep this in mind and ensure proper training for healthcare professionals to prevent this from happening. I think it will be really important to train the healthcare workers with the introduction of these algorithms in clinical medicine in the near future. Thank you.
Thank you very much, Doctor.
¿Alguna otra pregunta? Acá adelante tenemos una. Primero adelante y atrás. Gracias.
Well, thank you for your conference. It was very opening our minds on who's doing on this sector. I'm librarian. I'm working for academic libraries in Colombia, and we are right now upscaling the abilities on artificial intelligence for libraries around the world. So my question is about what is WHO doing about the possibilities that the everyday people has now with the large language models. You know, the large language model allows to the people to ask directly about her health. So how can we educate the people about the risks of these large language models to be used in this health, and how the WHO is preparing for not only educate, you know, doctors, but people about the use of LLMs?
Thank you very much. Again, excellent question from Colombia. So you're absolutely right. The generative AI or LLMs large language models are a very big concern. And this is why already 2 months ago we called together our expert group on the ethics and governance of AI for health to develop original guidance in this area of generative AI. And we're just at the point of finalizing because this will be edited at the moment. And within the next 3-4 weeks, we should be publishing a specific original guidance in this area. The concern is, as you say, many patients around the world have been using what they sometimes call Dr. Google for advice on their conditions. And I think with technologies such as ChatGPT, this has only increased, and there will be more and more usage of these technologies. And that is a big concern, because often patients really lack the understanding, the judgment to really assess whether the information that they're getting is reliable or is actually misleading or is complete nonsense. So from my point of view, there's the biggest risk usually for the patients and the lay public. It's less for the professionals that search or use ChatGPT and other technologies, because they can actually judge whether the information they're getting is of good quality or not. So whether you can be aware of who, I think for patients who cannot have this knowledge, they might be at risk of taking a wrong course of action or trying to get medication which is not appropriate, and that can be very risky.
Thank you very much. We have only time for one last question. Una última pregunta. Muchas gracias. ¿Tenemos alguna última pregunta por el tiempo? Muchas gracias.
Good afternoon, doctor. Congratulations on your presentation. It is an honor to be able to ask you. My questions about public health. So, what I will contribute to public health, AI.
I think the question was that what would AI contribute to public health, or how AI would contribute?
Yes, thank you very much. That's also a very good question, because so far we talked more about the clinical setting. So, AI can contribute a lot, not only in the clinical setting, but also in health research and in public health. I think what we have seen, especially during COVID pandemic, is that there are more and more AI-based tools that are being used. For example, for research and development, for identifying much quicker than before suitable molecules for medications or for vaccines. But what we have also seen is increased usage in public health surveillance. And there is an enormous amount of data if there are outbreaks, but also in the peace side, enormous amount of outbreaks. There is more data being shared, and AI can be very helpful to analyze that data and help with the identification of disease spreads, for example. So, Virtual has recently established a hub for pandemic and epidemic surveillance in Berlin, in Germany. And I think it's going to be very important to use AI-based tools in order to do public health surveillance on a global scale. So a lot of potential uses for AI and public health as well. Thank you very much.
Thank you very much, Andreas. We've run out of time, and we are really grateful to having you in this international forum, and we hope we can have you in presence next year. Thank you very much. Muchísimas gracias.
Agradecemos la valiosa participación del Dr. Andreas Alois Reis.